can also, the panelists can, all right, looks like we are live to Facebook. Hi, everyone. Thank you so much for being here.
Yeah.
No picture. I did it by phone.
We are really pleased to welcome Sarah and Nate as our panelists this evening to discuss self-advocacy in the workplace during COVID-19. They both have some really interesting perspectives to share with us, so I'm really excited to be able to welcome them. I'm going to start by introducing NAMI-NYC, the host of this event.
Called her at
I'm gonna also, as you can see, it's sometimes we get some background noise, so I'm just gonna make sure that everyone's muted.
Stop it.
Including you, June. So I'm going to start by introducing NAMI-NYC, and then I'm going to turn it over to our speakers to introduce themselves very briefly, and then we're going to have a conversation. And we've got some questions prepared. We're going to have some interesting discussion points, and then we will open it up to questions from the audience. As a reminder for folks in the Zoom chat, this presentation is being recorded and streamed to Facebook. Hi to those of those of you who are joining us from Facebook. For those of you in the Zoom, you can ask questions and discuss and introduce yourselves in the chat. For those of you on Facebook, please do feel free to ask questions and make comments on the Facebook live stream. Goodness, we're just having a lot of trouble with keeping people muted. Let me see if I can fix. Okay, that's fine. I'm not going to worry about that right now. So yes, please feel free to ask questions and make comments on the Facebook chat or the Facebook live stream as well. Those will be noted and will be passed on to me as the moderator to ask our panelists. Okay. Great. For anyone, if you have questions after the event, or if you're calling in and don't have access to the chat, please feel free to email me, Clara, after the event with any questions or comments that you may have. And that you can reach me at CKIELY@NAMI-NYC.org. And I'm going to put that in the chat as well. Great. I'm just gonna mute everyone. There we go. And now everyone is muted but me. Okay. Lovely. So this event is hosted by the National Alliance on Mental Illness of New York City, which is a grassroots organization providing support, education, and advocacy for all individuals and families impacted by mental illness. So what that means is we have free classes and support groups and other services for anybody who's dealing with their own mental health issues or who's supporting somebody else who, a family member, a friend, anyone in their life who may be dealing with something and that wants to learn how to better support their loved ones. I want to highlight during this time, we are offering a large number of support groups and classes remotely. So you can access our calendar of support groups by going to NAMI-NYC.org/calendar. I'm going to put that in the chat as well. You can also call our helpline, which is a great resource, not just to find out about our services, but also to get referrals to other resources throughout New York City as well. So again, that's NAMI-NYC.org/calendar. And I will, when I finish this little introduction, I will put the helpline number in the chat as well. Cool. Okay. So with that, I apologize for the chaos of that introduction, but I would love to just very quickly introduce our speakers. Nate Pelzer is the CEO and founder of Clinify Health. Sarah Bogdansky is a certified coach through NYU, works with MindWorks. and we're honored to have both of them with us today. Sarah and Nate, would you be able, before we go into the questions and discussion that we have prepared, would you both like to just briefly introduce yourselves in more detail than that little introduction that I gave you, and talk about your relationship to the concept of sort of self-advocacy for mental health, healthcare access, especially during COVID-19. So I'm going to unmute you both. Okay, Sarah, why don't you go ahead and start us off?
Thanks so much for the intro. I'm so excited to be here. So as Claire mentioned, my name is Sarah Bogdansky, and I'm an NYU certified coach. I'm also a coach for MindWorks. And I spent 16 years in the corporate world in New York City. And now I'm coaching mostly folks who work in various industries across the States, mostly from corporate backgrounds. And so in terms of mental health, I do a lot of mental health coaching along with life and career coaching, but mental health has become more prominent in my practice the past couple of years, and especially the past couple months with everything going on with COVID. It's been a huge issue and topic, and something that people really need a lot of support with. So it's been an honor for me to work with all kinds of people to help them work through, the added stress and anxiety they're dealing with, this other layer really that people are dealing with beyond the everyday stressors people have.
Awesome. Thank you so much. Yeah, and we're really happy to have you with us. Nate, would you like to say a few words as well before we get into our questions?
Sure thing. My name is Nate Pelzer. I'm the CEO of Clinify Health, and we are a population health analytics tool that ties together financial, clinical, and social determinants of health data to help providers move into proactive care, or what we call value-based care models. And in terms of COVID-19, the impact has been widespread, I think, across the behavioral health side of the healthcare system as well as the clinical side. And as you guys know, one ties to the other. So we've seen people that have had common clinical conditions that have resulted in acute exacerbations requiring, emergency or urgent care, where otherwise they would have been managed just fine. And then obviously on the behavioral health side, dealing with everything that's been going on has increased the inpatient behavioral health activity that we've been seeing as well.
Yeah, absolutely. And I know from our end, we know that inpatient care has become a lot harder to get because of the limits that have come into play. Like I know of folks that I talk to through inpatient psychiatric care where units have been closed down to be made into COVID-19 units, just as one example that I've seen. Thank you. And thank you so much for being here as well. So let's kind of dive into this conversation. Nate, you talked about your sort of expertise in terms of the data. Can you talk a little bit about what the data says about how COVID-19 has affected healthcare access over the last couple of months?
Sure. So it's a little bit of a tricky question, right? I think that answer is, what the lack of data has told us. I think in some regards, most states have, restricted elective procedures and medical administration, reduced outpatient facility operations. So truly, we've seen just a complete drop in anything that's really not COVID emergency department related. And then, as I mentioned, people that otherwise are healthy, we've seen examples of them being admitted to inpatient facilities for behavioral health issues that are driven by COVID. So that's the one side of it. There's just lack of what's going on. And I think everyone, including providers and insurance companies, are trying to figure out where the wave crests and where some of this pent up demand is released. And then the other sort of implicit, I think, outcome of COVID is, 20 to 30 million Americans that have lost their jobs, that ultimately will result in less access to care, right? Obviously, you've got people that were insured through their employer who will now be uninsured. And, you know, in some instances, a best case scenario is they're now on a state-sponsored program like Medicaid, which from a supplemental benefit perspective doesn't have the same access to certain clinical and behavioral health you know, tools that a private or commercial plan would have. So the jury's still out on what the full impact's going to be, but we know that access to care has been limited, and for the communities that we work in, underserved communities, it's made a bad situation even worse, because people don't know how to deal with some of the things that they're facing from a behavioral health perspective, and then you know, B, don't have the access to actually get the care if they do want to deal with it.
Yeah, definitely. Thank you. That's I think that's a really important framing as we go into this conversation, to sort of understand how broad the impact is, that we don't even really fully understand it yet. Can you also talk a little bit about what you see as the most important takeaways about sort of employment and healthcare access that we can get from population level data? So you talked a little bit about how the loss of employment that a lot of people are facing has a really direct and obvious impact on people's access to healthcare. Can you talk a little bit more about that?
Yeah, and you know, with everything, there's a lot of gray between the black and white, right? So obviously, you know, statistically, people have better health outcomes that are employed versus those that are unemployed. The other side of the equation is, you know, the single mother of 2 or 3 kids who now has to take on an extra job because her hours have been cut or her wages have been cut. So employment is an indicator in general that, you know, people have access to care, but depending again on the other social circumstances that are impacting them, it can be either a positive or negative influence on individual populations.
That makes a lot of sense. Sarah, can you so kind of going off of that, right? I think that's a good way of putting it, right? Employment can have either a negative or a positive effect overall, depending on everything else that's going on. And I think COVID-19 is a pretty big everything else. Sarah, can you talk a little bit about what you've noticed about how your clients and the people that you work with are responding to COVID-19 in their work lives, in their, Can you talk a little bit about that?
So most of my client base are professionals. They range from young professionals just sort of starting out all the way through, you know, people getting ready for retirement, and across a lot of different industries and sectors. But there are some themes I'm seeing coming up with everybody. So aside, like I was saying, aside from the general stress people face every day with their jobs, with life, COVID-19 is definitely adding this extra layer. And what's going on is generally stress and anxiety levels are much higher than usual. And, you know, there's a lot of reasons for that. People are afraid they're going to get sick or someone close to them could get sick. A lot of people are afraid they're going to lose their jobs because so many industries are being impacted, and there are a lot of changes happening at a lot of different companies and across a lot of different industries, unfortunately, from an economic standpoint. You know, routines are being thrown off. So people aren't sleeping well, they're not eating well. There's a lack of movement and exercise. So just some of that self-care has changed because their routines are so thrown off. A lot of employees are talking about, you know, there's this lack of sort of focus and motivation because there are so many unknowns and there is so much stress that people are finding it hard to just focus and stay motivated at work. Isolation, you know, that's a big one. People are isolated, they're lonely, they miss that office environment, you know, being forced to work from home to stay safe, of course, but they miss that interaction, you know, being with their peers, having that in-person connection with their team and with their managers. Then you have the working parents who are having a tough time also coping because they're trying to figure out how to parent, have their job, and be a teacher at home. A lot of unknowns about schooling coming up and trying to just balance that all. And then, you know, across the board, again, there's a lot of people who just don't know how to cope, right? They don't have the tools or resources to cope through this extra added layer of stress and anxiety and uncertainty going on. And a lot of times, unfortunately, they are dealing with this sort of on their own, and they're not comfortable really discussing what they're experiencing with their manager or their peers in the workplace because of that stigma still around mental health that exists.
Yeah, it's a lot of stuff.
It's a lot of stuff.
A lot of layers.
Yes.
And I see actually a really good question in the chat, which we can get to in a little while, about, you know, what is this going to look like for employers after this, you know, if people are sort of seeing this increase in depression and anxiety and stress related to everything that's going on, how is that going to manifest kind of going forward? And so we're definitely going to get to that question. I think I'd love to sort of throw this question out to both of you. I think it's a good framework, again, to kind of contextualize everything that we're talking about. What has been both of your experiences dealing with mental health issues that have impacted you at work? What's been your experience with that, and how did you handle that, if that's something that you've experienced? Maybe let's start with Nate. Mind?
Sure. Well, thankfully, I've not had any, you know, major issues with mental health issues in work. I would say, honestly, the most impactful thing has been COVID, right? Learning how to deal in this environment, learning, you know, everything that Sarah just said, the isolation, working remote from the team, the challenges of things that used to be easy in today's day are not necessarily as easy. So, you know, that's probably been the closest I've come to anything related to mental health challenges. And I'd say the thing that I've learned the most is buckling down and kind of getting a routine in terms of, especially in this world where everyone's doing stuff autonomously. Some people feel like they're always on, you know, some people are now getting up later than they used to, starting work at different times. For me, the best thing that has helped me deal with all of the noise is, you know, a strict workout routine, spending time reading some of the wellness things, meditation, really to refocus on what I'm trying to do that day and that week, as opposed to having your mind run all over the place because everything's chaotic right now.
Yes, absolutely. Absolutely. Sarah, would you like to speak to that question?
Yeah, sure. So I actually did go through a pretty rough time a couple of years ago personally. I went through a pretty traumatic life event, and I did take some time off, but looking back on it, and I kind of realized this sort of as I moved through my own healing and working through the grief, that I didn't really take enough time to get the help I needed at that point in my life. So I took, I think, a week off, and I just didn't realize in that moment that I really needed more time because I was so focused on being productive and being that star employee that I always try to be. So I didn't ask, I didn't ask what my options were. And it's interesting because as time went on, I had a conversation with someone from the HR team that I became friends with, and they're like, you should have taken more time. Someone from the HR group that you were, from the group you were in should have probably suggested that based on what you were going through, because the company did know what I was going through. And again, it's one of those things that I wish I would have owned more, right? I didn't handle it maybe the best way. And I came back to work too quickly. And I definitely had a really tough time focusing and kind of putting my best foot forward for several months. I wasn't as productive as I normally am. And so I guess the learning I had from that experience, that personal experience, was, really accepting that it's okay sometimes to not be okay, and to really advocate for what I need and put my mental health, like, how I put other, areas of my health first and foremost, because it's hard to be productive and provide value at your job when you're not taking care of yourself and getting the, the right help you need.
Yeah, and I think that's a really important point and I think it ties really well into the broader sort of theme of this discussion about self-advocacy and sort of saying, this is what I need in a in a workplace environment. And I think that there's a lot of things that makes that a lot of really systematic and structural factors that can make that really, really hard to do. And I think you sort of spoke a lot of what you were speaking about kind of was like on an internalized level of like, I have to be productive. I have to, do certain things. But I think there's also definitely sort of these broader structural issues that factor into that. So I'm wondering if you can both, and I think, Nate, you might be able to speak to this more on like a population level in terms of family structure and income, job security, things like that, how those factors impact somebody's ability and willingness to actually advocate for themselves. So can you sort of maybe both talk about maybe Sarah, you can start because we were just talking about how this played out in your own life. And then we can talk about kind of more on a population level. What are the factors that affect people's ability, willingness to advocate for themselves around mental health issues in the workplace? Can you talk a little bit about how you see that?
So again, what I see coming up for people is that stigma, right? That stigma attached to admitting, hey, I need some more help here. I'm kind of going through this issue, or I have, diagnosed mental health issues that I need, more support on or have special needs for. So a lot of people are not comfortable bringing that up. There's also just a general fear, I think, of being seen as weak or impaired. If you do admit to a mental health issue, and there's that fear of, if I admit this, I'm going to seem weak or incompetent or whatever, someone might think. And there's that fear of like, I'm not going to advance, right, in my work. Again, and I think especially right now, people have a lot of fear. They're trying to keep their job security. They want to have that consistent income. They don't want to, ruffle feathers. So again, people aren't necessarily going to communicate those needs around mental health because of that fear that it could somehow jeopardize their position or their work. And then again, I think, so many people at work, they're under a lot of pressure to produce, and they're not really wanting to take that time to address what they need to address. They're too focused on output and productivity first. So for example, not making the time to say pre-COVID, leave the office for an hour to go to that therapy appointment, or even during COVID times, not taking that time that they might need because they're just so focused on being productive and keeping their jobs. So those are the biggest factors that I see come up with the clients I'm working with.
Yeah, that makes a lot of sense. Nate, can you sort of speak about what you see as being maybe I can sort of reframe the question if that would be helpful, but can you speak to this question sort of on a population level?
Yeah, so I would say that it falls into two categories from a population level. One is family environment, and then, and Sarah's touched on both of these, family environment, and I would say cultural norms, right? So, obviously if you, again, are a single mother with 3 kids at home, you don't want to lose your job. It may make you bite your tongue when you think that you should be advocating for yourself. If you have, whatever the situation is, a mother that's on dialysis and your job allows you the flexibility, those circumstances, I think, influence people's ability to advocate for themselves in the workplace more than anything else. And then, the hidden factor is those cultural norms, especially in the African-American community. Admitting that you have a mental health issue or seeking help for a mental health issue has a stigma associated with it. And that's a barrier to a lot of, especially African-American males, seeking help for something that they know they probably should. So I think, in terms of when we think of the patient profile and all of the various social components that make up our day-to-day lives, those two to me probably stick out as the biggest impeding forces to advocating for oneself in the workplace.
Yeah, thank you. That's great. Can you both talk about how sort of going off of that, how has COVID affected some of those factors? Like how is, all of those factors I think are absolutely big aspects of that impact people's ability to sort of do that self-advocacy. How has COVID kind of changed the landscape in terms of those factors? Maybe Nate, you can start and then we'll go back to Sarah.
Sure. So I won't be the first person to say anything positive about COVID. And I would say that, anything that was already stressful, COVID just made it more stressful. So if you were already trying to juggle, getting kids to and from daycare, a job, getting the car fixed, and now COVID hits, things are closed, you have to manage, your kids and their educational change in curriculum, all of that just adds more and more stress and anxiety to the situation. So I think that ultimately, again, it creates a bigger barrier to what was already a barrier for a lot of folks to seeking out the care that they need. On the flip side, I think a lot of companies, especially the technology companies that have a lot of remote workforce, I think that they have adopted policies and adapted to this environment to make it as easy as possible for their employees to address not only just their living concerns, but potentially any mental health issues that are arising from the situation. And I think continued advocacy on the part of the employer for the employee is needed to make sure that people get the care they need through the workplace.
Can you say a little bit more about that? What advocacy? So, and then I'll definitely jump back to Sarah. Can you say a little bit more about sort of advocacy that employers might need to do in this situation? I think that's a really interesting point.
Sure. So regardless of the company culture, right, a lot of human resource departments, legal departments have ways to raise an issue either directly to a senior manager of an organization or anonymously if it's something that should be kept anonymous and confidential. And I think those programs, especially when you're talking about something like mental health where people may feel a way about coming forward with it, if they're not in place, need to be put in place, and the ones that are in place, making sure that they're working and that employees know they have access to them is key, because it's really hard to feel like you're the only one, which we always all do. We feel like we're the only one going through something, to go then to, whether it be your boss, your manager, someone in human resources, and raise an issue without having that sort of outlet to latch onto.
Makes a lot of sense. Thank you for elaborating. And I think there were some questions in the chat about that as well, so we can get to that, come back to that later. So Sarah, if you would like to speak to this as well.
Sure. So again, just some of the impacts this is having. So again, people are suffering a lot right now. They're doing it many times in silence, kind of what Nate was speaking to. They're not able to communicate what their needs are. And there's that lack of focus, productivity, and motivation. I'm also seeing that a lot of people feel stuck, right? They feel like they have to kind of stay in a work situation that maybe they would have otherwise changed if we weren't in this COVID era. So people are kind of staying put and kind of working through and dealing with tough situations at work because they're, again, just trying to not ruffle feathers and not make waves during this uncertain time. A lot of people too, and I think Nate touched on this a little bit earlier, that people are having a tough time transition to working remotely and to not being in an office environment. And there is this sort of like always on mentality. People are not really sure of how to create those boundaries around work, even workspaces in their home and their schedules that can help them be productive while they are working. And then on top of that, a lot of leaders, they're not really sure how to manage this. They're not provided with resources or guidance on helping employees on this more personal or health related level. I guess the silver lining in all of it that I'm noticing is that, companies that do provide mental health benefits, people are using them. So that's the good news, is I think if people are aware that they have these benefits, and they can range from, their company completely, paying for therapy or coaching or whatever they need to different, helplines and different groups. I find that people are using them and working through that added stress and anxiety with trained clinicians such as therapists or coaches. And again, I think during this period, people are really assessing what's important to them and taking those, I'm seeing a lot of people taking some steps and making changes towards maybe more personal goals. If they feel like, okay, I need to kind of stay put in my job, but what else can I do? I think people are taking, they're kind of figuring out, well, what's important to me in this new world. And then even though a lot of leaders might not be equipped, there are some that are aware, like, okay, I need to figure out how to take some different steps to addressing this with my team during the pandemic. So I've been working with a lot of leaders who are, I'm helping them sort of figure out how do I still help my team be productive, but yet be an empathetic leader, right? How do I check in more, practice empathy, allow more flexibility with schedules? For example, working parents who don't have childcare and maybe need to work some alternative hours, how to work with their different employees based on their unique needs.
Just as sort of a follow-up to that question, Nate, you talked about how one of the factors that just generally affects people's willingness to sort of self-advocate is cultural norms. How do you think, if it has affected cultural norms, how do you think that COVID-19 has affected some of those cultural norms around self-advocacy or sort of mental health more generally?
So in terms of especially the underserved populations that we work with, our chief medical officer, Dr. Garth Walker, wrote an article in the Sun-Times that was titled, "How do I tell a family of 7 that lives in a bedroom of 2 to self-isolate?" I think those family norms that, because we all live them, our lived experience doesn't make each and every one of our single situations seem unique to them. It's taking what seemed sort of normal and flipping it on its head, right? A lot of folks, especially on the south side of Chicago, have multiple generations in the same household. There are, younger professionals that are going out working and now having to worry and have anxiety about coming home because their grandparents live with them. Those are the things that I don't know that there's a solution to yet, but it's making a lot of folks aware of what previously either was taken for granted or not really acknowledged as an indicating preceding factor towards potential behavioral health or clinical outcomes. And now people are looking and starting to say, hey, there is actually an association between these familial norms and whether it's COVID or just access to healthcare, transportation, whatever it is, these things interplay with each other and ultimately impact people's health outcomes and mental health outcomes.
Absolutely. Yeah, I think the point about bringing things that maybe had sort of been taken for granted or not really looked at, and suddenly they're coming out and becoming more obvious. I think some of these relationships are definitely becoming more noticeable. Yeah, Sarah, do you think, do you sort of see any kind of cultural or attitudinal shifts based on COVID-19?
I mean, everything Nate is saying makes a lot of sense. I do work with some professionals who do live in multi-generational homes. Again, with those fears that he mentioned, and just trying to work through how do I balance this? So I'm seeing a lot of the same thing with those different groups.
Yeah, that makes sense. So, okay, so we've talked a lot about what the situation that we're in and the kind of where we've sort of arrived at collectively over the last, however long it's been, 5 months. And I think, and you've both made some really good points in terms of how things that sort of make self-advocacy, I think, even in the best of times, really difficult, and that just is even more difficult now. But I think it would be great, I think especially Sarah, if you could talk about some things that you have seen be effective in terms of a framework or strategies for self-advocacy in a workplace kind of setting.
Sure. So a couple things. First and foremost, if your company does provide mental health resources, using them, right? Utilizing your HR team, learning more about what options might be provided at your company, such as EAP or other mental health resources. Many companies are getting on board and already are starting to provide even more mental health resources and programs. So really for the employee, it's finding out if the company, again, they communicate these things out, but sometimes you miss it or it's not clear. So really getting clarity on all of the details and really using it to their benefit. Again, if it's unclear what resources might be available, ask or advocate for having those resources be communicated out to the company. So even simple things as like, and again, this is pre-COVID or when we all go back to offices, but even just having signage around around the building where people work, just to let them know, hey, this is available to you, having ongoing communications. A lot of times when people start at jobs, they get sort of their onboarding and learn about all the different benefits they have, but then they kind of forget about it. So just having that constant communication loop of, hey, this is available to you, or this is a new resource available to you. And just sort of being on top of that for yourself, and also if you're a manager, for your team. I think for people, being really aware and really realistic of what their individual needs are, and finding a way to have those conversations with their manager. So as it relates to COVID, I'll go back to the example of the really stressed working parent who needs to potentially work maybe some alternative hours so that they can provide for their children during those working hours. So again, going to your employer or your manager with actual solutions of, hey, this is how this could work. This is how I can still stay productive, but also, figure out how to listen to my individual needs that I need to do at this time or during this period. Another option is to always, meet with HR and see what your options are. Something else too I want to stress for people is just generally like self-care practices go a long way. So setting aside those healthy breaks during the day, taking time off when they need to, resting, creating boundaries with time and space. So for example, a lot of clients I've been working with, they're like, I'm working all the time, I'm working from my bed, kind of designating a space or a little nook somewhere in your home that's where you do work and that's only where you do work. And again, this always on mentality, a lot of professionals are having, sticking to a schedule so that you're creating those boundaries so that you're not just literally on all day. And then again, communicating those boundaries to your peers and managers as needed. So for example, not feeling like you're expected to answer emails at any hour just because you're home. And then with isolation due to COVID, finding ways to practice healthy living and getting creative, right? There's virtual workouts available, taking those fresh air walks, meditation, trying to stick to a healthy routine with eating and sleeping, and recognizing that making that space and time to do these things will actually help you be more focused and productive. And it's even better when, management encourages this with their teams. And then for leaders and people that, lead teams or manage others, beyond just the work and the output, really checking in with staff and, figuring out how do I validate and empathize and really listen to what their needs are. And again, a lot of leaders have come to me saying like, I'm not sure how to do this the best way. And it's, finding those resources or even asking their management or leadership for guidance or training on how to do this. I would also say for leaders, leading by example, because many times employees are mimicking what their managers are doing. So they, essentially look to their managers on what's expected. So if the manager is always kind of answering emails and working through the lunch period, don't be surprised if all your employees are doing that too, which might not be healthy, right? It might not be the best for them. So again, taking those breaks, time off, and then time for fun, and just, you know, having, still creating that time, even if it's virtual right now, to build that healthy, strong, focused team culture. On top of that, you know, leaders, because of their position at companies, you know, they can really advocate for employees. So again, if the company doesn't provide mental health resources, you know, leadership is in a position to speak up on behalf of their staff and using that authority to really advocate for their team and well-being. And then lastly, I would say for leaders and people that manage, you know, just trying to be as accommodating as possible based on your employees' needs. So again, they can be unique. So it's, again, having those conversations where you can get to the root of what people need and really listening and helping them figure out, how can I be more productive? You know, how can I help you provide more value and boost morale during a time when stress is high, you know, people are going through a lot of different mix of emotions. That's super important right now.
Absolutely. Yeah. Thank you for all of those. I think those are all important, an important perspective for folks to have in terms of ways to make a workplace a little bit more functional, even during this very dysfunctional time period. So I think, so we had a comment from Facebook that I think I want to go ahead and read and get both of your sort of comments on, which I think goes a little bit beyond what we're talking about, but I think it's a reality that a lot of people are facing. So I want to kind of bring it into the conversation. So from Facebook, as a certified school counselor in an area of the country considered a major hotspot in relation to COVID cases, I am afraid to return to a brick and mortar setting in 6 days. I want to be supportive and productive in my role, but I'm also fearful of having contact with potentially 800 students and staff and families. In addition to the stress and anxiety that many are feeling returning to schools without any options to do so safely, I continue to see the, I think the person meant deluge of negativity and the attempts to shame those feelings, especially over social media. It's hard to feel supported during this time when so many are made to feel ashamed for these feelings. Can you both sort of talk about what advocacy could sort of look like in that situation that I think many people are facing of having to return to a physical workplace and not feeling safe doing so? It's a really hard question. So I don't mean to put you both on the spot, but I think that is a situation that a lot of people are facing. So I'd love to see if we can provide some perspective on that.
Yeah, I can provide a perspective. I think Sarah's a little more qualified to talk about it than I am, but you know, I would say the thing that works the most whenever you're dealing with these sort of situations that are affecting the same population of people, in this case teachers, seems to be the group support, right? So to the extent that I think school districts, you know, states can put in place at least outlets to allow these folks to gather and voice their concerns, it's a starting point. You know, the ultimate solution is a little bit more challenging. Obviously, you've got people concerned about their personal well-being, and I think you've got parents concerned about their personal sanity on the two sides of the coin. So I don't know what the right answer is in terms of what to do, but in as far as a bridge to feeling like you can manage the anxiety and stress, my suggestion, what we've done in our company, and I know a lot of other companies, is just open up the collaboration tools, the group resources as much as possible. And then from there, if there's, you know, a critical mass of voices, I would assume administrations in different areas would have to at least have conversations around how to address it in a more substantial manner.
Absolutely. Absolutely. Sarah, do you want to say more about that as well?
No, everything Nate said was so spot on. I feel for teachers right now. I think they're in a really tough position. I personally know a lot of teachers. They're all very stressed out. And a lot of them don't feel like they are getting the support they need. So again, like that group effort to have those conversations and to voice the concerns and to figure out how do we make this work so that everyone feels safe, but we can still move forward in some way. And again, having those tough conversations. And I think on the individual level, with all that stress and anxiety, it's figuring out, and again, it's so individual based, but it's like what, in the position you're in, whether it's a fear because of your own health, maybe you have, health issues that you really can't afford to get sick, or maybe you live with your, elderly parents and you don't want to bring anything home to them. There's so many different situations. So it's figuring out, what can I do? What's in my control? What can I work through? And I know that's a tough spot for people to be in because people need to be working. But figuring out how do I have the conversations I need to have to advocate for myself, and feel safe doing so, and then getting the different support they might need, whether that's through therapy or support groups, but figuring out how do I work through this tough time and get as much support as possible, because it is a really big predicament I think a lot of folks are in, with having to go back, whether it's teachers or other folks that have to go back to an office environment or an environment around other people that don't feel safe.
Yeah, I think support is really crucial. And I think, Nate makes a really good point that finding folks that you have a shared self-interest with, that you're who are in a similar boat, and working together with those people, sort of collectively working, is really, really important. And I think it can start off as sort of a support thing and can kind of grow into a really, a collective organizing perspective. I think kind of jumping off of that, one of the questions from the chat was about what's a way to sort of advocate for, the specific question was about mental health days, but I think we can broaden it to how can people advocate for organizational changes to better support the all employees and staff's kind of health and mental health. And I think whichever of you wants to grab that can go ahead. I won't put either of you on the spot.
No, I can jump in. I mean, at the companies I've worked at, something that I find works in these scenarios is, again, getting that group together, putting together a plan, coming up with solutions, like first kind of coming up with something and then presenting it to leadership. I find that works well, because you're kind of doing a lot of the work that leadership might not be able to do. So it's really going to them with, hey, here's the problem, but here's the solution, and here's what we see could work here. And again, strength in numbers. So for example, at a lot of companies, there's different ERG groups, and sometimes partnering with the different employee resource groups and getting all the groups together to essentially come up with a plan and present that to leadership and say, hey, this is something we're hearing from employees across the company. This is something we need. And then, like I said, have that solution ready to go. Even as a starting point, it doesn't mean that's what's going to end up happening, but at least gets people's wheels spinning of, okay, we're hearing you loud and clear. There's some changes that need to be made, and these employees are already working on solutions. So that would be one way you could do it.
Yeah, and I would just echo everything that Sarah said. I mean, when it comes to, the clinical side that we deal with more, the way that we work is we'll essentially risk stratify and say, hey, here's the situation with your patients. Here are the things that need to be done to those patients, and here's the expected outcome. So If you have a significant portion of a patient panel that's morbidly obese, their costs are going to be higher than those that are not. So there are wellness interventions that you could put in place to help make sure that they're on a path to, maintaining or losing weight, and ultimately their costs will go down. I feel like it's the same approach when it comes to wellness in the workplace. As Sarah mentioned, if you can put together a case of it's impacting, this amount of people in this way, and it's affecting productivity, morale, culture, whatever it is, and then explain the benefit of addressing it, I'd be hard pressed to feel like organizations wouldn't at least give that consideration as something to sort of roll out.
Yeah, you've both definitely used the term, and we've all used the term productivity, which I think, and I think there was a question that was raised in the chat about that, which I think is interesting to talk about it again in the context of self-advocacy, and especially of advocating within an organization for changes in policy within an organization. So there's definitely a concern, I think, especially in discussions about mental health, but also I think in health concerns in general, that the idea of loss of productivity will sort of be used against someone, that there's that fear that, if I admit that I'm, dealing with this health issue, whether it's a mental health issue or a physical health issue, whether it's a chronic illness or any kind of long-term health issue, that someone will be seen as less productive. So what do you see, how might it be possible to have a conversation, especially with managers, HR leaders, as you termed them, Sarah, about changing what productivity means and how it's valued?
Sure. So some good news is something I am seeing across a lot of companies is they are changing in terms of goal setting for their employees and performance reviews and those types of things. They're being changed during this time. So for example, I coached a sales leader from a pretty big company, and she was telling me that the company actually brought the sales goals down for the entire revenue team because their expectation was the team, first of all, it's hard to get business right now, so they're not going to hit their quotas, and we don't want to penalize them for that. And on top of that, we know people are just going through a really stressful time, right? Everyone's dealing with different things. So we're not going to have the same expectations of productivity that we typically have. So that's the good news, is a lot of companies are recognizing that and making shifts in how they, assess their employees' work. Now, if that's not happening and, people are realizing wow, I just, can't be as on or 100%, that's okay. They have to have those conversations, which are not easy to have. But I do think, again, because of what's going on, a lot of leaders are being empathetic and working with their employees on, it's okay, well, what can you do? What is possible? And again, having those conversations to level set. It's really about expectation management. So if someone is, hey, I have to watch my kids several hours a day while I'm trying to get emails done and trying to get these reports done or whatever the work is, it's just being really forthcoming about what is possible, what's realistic during this time or maybe another time, right? If the employee, let's take COVID out of the picture, but it's just another, tough time. Again, it's having that conversation. And I'll use myself as an example. So when I was going through a tough time a couple years back with that scenario I mentioned, I did have a conversation with my manager, and I said, I'm really sorry if I'm kind of out of it. I want to come back to work, but I don't know if I'm going to be as sharp, as I normally am, because, you know what I'm going through. And he was, again, I was very lucky, but he was very understanding. And I think having that conversation, even though it was difficult for me to admit that, I think, having that conversation and letting the manager know your needs or what's possible, again, just to level set. So those are just a couple ideas, but I am seeing companies taking note and also changing, I'm seeing companies completely doing away with any sort of performance reviews during this time, because they just know that people aren't going to be, performing at the level they normally do.
Thank you.
Yeah, and I would echo, I think having that conversation proactively rather than retroactively is key. Otherwise, it's, it can be viewed differently when it's a precursor to a situation. And second, I totally think that you nailed it, Clara. The term productivity and the measurement of productivity is going to change, I think, across the board for organizations. Even, years ago when I graduated from undergrad, I was told if you show up on time with enthusiasm and a smile, you'll be, 95% ahead of everybody else in your starting class. Well, if I was given that advice today, I don't think it would get me very far, smiling and sitting on my couch. So the whole notion of productivity from, junior level employees all the way to senior level employees and organizations as a whole, I think are going to change. And then the onus is a little bit on the individual to say, hey, this is my situation. This is what productivity means to me and what I think productivity, what my max productivity is, and have that conversation with their employer, again, ahead of time if possible.
Yeah. I think so. There was a question, which I think is we're wrapping up, but there's a couple last questions that I really want to get to because our audience has just been really great. And one of them was about people who are maybe not currently working but are unemployed. Nate, you mentioned the millions of people who have already been impacted employment-wise and who are, I'm sure, going to continue to be impacted. What advice do you have, or what perspective do you have on folks that may be looking for work and trying to get employment, and how these conversations could maybe factor into that process?
Can you clarify, Clara?
Sure. So, well, the exact question was, can you address people who are unemployed and looking for work now? So I extrapolate that to mean, what does self-advocacy or sort of having these, as you mentioned, Nate, collective conversations, what does that look like? Or rethinking productivity, like what does that look like if you're actually trying to get employment?
Sure. No, I got you. So again, I think that it's really looking in the mirror and having an honest conversation with yourself around what are you looking for? What are you sort of willing to take when it comes to employment, and making sure that that conversation is had with the employer, post offer, but pre-acceptance of the role, just to make sure that there's level set and expectations up front. And for each person and each situation, it may be different, right? Some people may be forced to take a job that they either don't like, that is a step back in pay and title, simply because they have other things to consider, like insurance, like access to care. And that getting to that position really only comes if you take the time to understand where you're at, where you're trying to go, and what your needs are along the way.
Yeah, that I couldn't agree more. Sarah, do you want to maybe speak to that question? And then I think that may be our last question before we have to wrap up.
Sure. So yeah, everything Nate said is spot on. I think it's figuring out what are your values, right? What are you going to value if you're unemployed and you're looking for work? It's like, what's important to you as you move forward? What do you need? And assessing that during the interview process, right? And I always remind people, because I work with a lot of people looking for work, and I always remind people that the interview process isn't just them interviewing you, you're interviewing them, right? So you're also finding out, is this the kind of company I want to work for? Is this the right position based on my needs, whatever those might be? And then like Nate said, having those conversations post-offer, but before you accept the role, and just really clarifying if there is something specific you need. So for example, if, Fridays you need to work from home, or you need to start, instead of 9 a.m. start, you need a 10 a.m. start because of your kids, or whatever it might be, having that conversation on being really upfront with what your needs are, again, advocating for that. And again, during the interview process, just assessing what's important to me, what kind of place do I want to be at? And even with the manager you'd be reporting to, does this manager, based on the questions I'm asking, do I sense that this manager is going to support my needs? And not being afraid to ask some direct questions during the interview process, because again, you're interviewing them as much as they're interviewing you.
Yeah. Well, and to different degrees, right? I think people have different, as we've kind of talked about, people have different degrees of ability to sort of to be picky, or to, make changes within their employment situation. And I think that's super important to acknowledge. But I think, Nate, the point you brought up about people working together and finding other people that are in the same boat, I think is really, really crucial. So I really appreciate you bringing up that point. Okay, so I know we didn't get to all the questions, but it's getting to be past our end time, and I want to respect our panelists' time. So we're going to wrap it up for this evening. Again, if you have any follow-up questions, please do feel free to email me, Clara, CKIELY at NAMI-NYC.org. You can also always call our helpline, 212-684-3264, if you need resources or additional support. We definitely want to do our best to be there for people and to provide that support, because as we've all emphasized, that's something that's really needed right now. So with that, I would like to give a big thank you to our panelists, Sarah and Nate. Where's our little applause emoji? Thank you both so much for being here. Thank you to our audience for the great questions. Thanks to everyone out on Facebook who may also be watching. Again, this will be recorded. This will be recorded and available on the Facebook page at NAMI-NYC, for if you would like to share or refer back to this presentation after the fact. So thank you again so much, everyone, and have a great night.
Thank you.
Thanks.
Have a good night.